Senator, you've been working, I know, very hard along with Chairman McNamara from the House side on changing or modifying legislation dealing with nursing homes here in Rhode Island. Why is that important?
Well, I think it's extremely important. One, because we are, each of us, all getting older, and it is, I won't say likely, because actually the number of folks who actually end up in a nursing home for any extended period of time, relatively small as to the overall population. But we are all getting there, but most of us at least either have had a loved one or know a loved one who's in a nursing home environment. And I think Rhode Island, despite a lot of what you heard when a very bad thing happens, has had a really good record and a really good tradition of good care in nursing home facilities. And in fact, that's almost part of what brought about the change you're talking about. All of the organizations that are involved in the ownership really have been talking about going into a new way of meeting the needs of their clients, meeting the needs of the folks who are in the nursing home. And basically, the model they have now really is institutional. And if you've ever been in one, it's a long corridor, 2 rooms off of it, 2 beds in a room. Everybody gets up at the same time, everybody eats at the same time, everybody goes to recreation at the same time. And none of us live our lives that way. And it is necessary for a hospital or some other institutions, but I think what folks felt was they'd like to see if they could do and develop a different way of meeting the needs of the clients in a reasonably cost-effective manner that wasn't so institutional. The reason that it had to have legislation is because in order to make sure that all of our nursing homes are viable, we a long time established pretty much a number of beds that were going to be available. And since we have reached 97% capacity, and that was probably 20 years ago, we've had a moratorium on any new beds. So, and we have continually actually reactivated that moratorium every year or every 2 years, depending on the legislation. These beds that are going to the new type of and they call it often Eden or greenhouse, the more, I'll say, user-friendly type of environment, are going to be taken from those beds, if you will, under the moratorium that are not being utilized in a conventional facility. Now, why do we care about the conventional facility? Because we do know that they need to have 94, 95% occupancy in order to break even or make a slight profit for their owners. We have found that if they go below that 94%, regardless of the good intentions of the owners of the nursing home, care does get hurt, does get diminished, and particularly if you start getting to 91, 90%, then you see that it becomes very, very difficult for them to maintain the staff and the people that they need to make sure that everybody is cared for properly. So what we couldn't have is a new venture, if you will, and unfortunately, I mean, and for instance, Leo Blaze, I think, is one of the real, free enterprise persons here. And I know actually he was reluctant to support aspects of this legislation because he really did suggest, let's just let the market, let's let people decide that they want to go to one facility as opposed to the other. And he was willing at least to pull back a little bit from that because of the concerns that we had over whether or not by opening this wide open, and particularly because some of the facilities really do have endowments, have the ability to much quicker move into this type of new environment. And we do think it's going to be attractive. We think it's going to bring people in, but we have to be able then to be prepared for the existing facilities having a lower population and making sure that they're still able to provide the care. There was probably a spike, and I'm going to say several years ago, of going up. And that was, I think, a result of medical advancements, being able to preserve life, which is, of course, always a virtue. But the people were much less able to deal with life themselves. And we have recently actually, and I don't know why, seen actually a downward trend in nursing home usage. And those baby boomers would in fact be coming of age right around now. In projecting out, however, they are saying within 3 or 4 or 5 years, we probably will see a spike back up again. And so one of the things that in dealing with this, we had to be able to preserve the facilities that currently exist, allow them to move into different directions that they think are more suitable for their clients, for the people that we're talking about, our elderly citizens, and also make sure we preserve the beds in the event that we do need them in the future. Now, when you project into the future, any number of things can change, but that is where they're looking right now. And so that was really part of the challenge that we had, to make sure that nothing we did interrupted, if you will. I mean, in the military, they always talk about your excess capacity. You want to have manufacturing with excess capacity so that if you need to ramp it up, you'll have the places and the facilities available to make machinery or whatever. And in a way, we had to make sure we preserved a certain amount of excess capacity in the event that we needed it. And so we're trying to make sure we preserve that, give all the facilities, and by the way, I do want to be very specific about this. There are private institutions, public institutions that nursing home cares, those associated with religious organizations. I mean, everybody who was in this area, I guess people will call it an industry or a business, but it's in many respects it's much different than that. It's an area, a avocation, was willing to come together. They all worked very, very diligently with us, as did all the state departments, DHS, the new Medicaid director, whose name escapes me right now, and Department of Health. Everybody just came, worked with us, and helped put us together. What ended up in some ways a modest change, but I think it's significant going forward. And when you realize all of the competing interests, I think it was a real achievement.
Well, and I would think that the senior community would really be receptive to this idea, and obviously it would make their stay and their care, I think, much more pleasant.
Well, I will tell you, one of the other things you have to protect, and people who work in this area will tell you, folks are not comfortable with moving or change while they're in or have adapted to a facility. So it really isn't, and you may remember the apprehension when we did the global waiver, and folks were responding very strongly to the governor and to us about whether or not they were going to be taken out of the nursing home or forced to make a different choice. And the thing we do know is that those choices, those changes are not comfortable for folks. So I don't know, I mean, there are certainly people within these homes right now that may decide to move to another facility. I feel that in all likelihood it will be newer clientele that will be coming in as opposed to a change for existing people. But again, where it has been tried before, it has been very popular. And I think people who do the surveys, which we do actually fairly regularly, about the relationship of the people with the facility and how they feel, we have a pretty good record right now. But these newer facilities where they've been located get even higher grades. The people feel very comfortable. They feel more to home, which is a virtue that I think all of us can strive for.